what's crazy about a startup is the same day you can think you're on top of the world. And then by the end of the day, you could think, oh, I don't know if we're going to be around tomorrow. Like that is the reality of running a company and a startup. But you can never let yourself feel either of those feelings. You just have to stay right in the middle. And that's the biggest challenge. And I think that the most important thing that I tell myself is nothing is that awesome and nothing is that bad.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Imagine watching your child's baseball game, cheering alongside fellow parents on a bright, sunny afternoon, when suddenly one of the parents collapses. Moments like this highlight an urgent, silent crisis, cardiac arrest, claiming hundreds of thousands of lives each year, often without warning. Today, we meet Sameer Jafri, CEO and co-founder of Avive Solutions, whose personal and professional journey has been dedicated to ensuring that these moments have life-saving outcomes. From his early days volunteering for cardiac screening to co-founding a groundbreaking nonprofit at UCLA, Sameer has relentlessly pursued innovative solutions for cardiac arrest prevention. His work culminated in Avive Solutions, where he and his team developed a connected, portable defibrillator, revolutionizing the speed and accessibility of emergency care. Sameer's journey is not just professional, it's deeply personal, informed by family experiences and the tragic loss of young lives he encountered early on. In this episode, Sameer shares the pivotal moments of his remarkable path, the challenges of pioneering medical innovation, and his bold vision for a future where cardiac arrest is no longer a silent killer. And here's our conversation. Welcome, Sameer. Thanks for joining me today.
Thanks, Christine, for having me. It's a pleasure to be here.
Yeah, I'm so excited to have you. It's been a while since we met. I think we met in person before COVID when you just started Avive Solutions. And it's amazing to see the progress that you accomplished. And I can't wait for you to share your story with our listener. And I always like to start with your personal story, your journey. What took you where you are today? What influenced you? And if you don't mind sharing.
Sure. Yeah. So I think it makes the most sense to start back in high school. I was a student athlete and I've played baseball pretty much all my life. And so I was always in competitive sports. And it was actually through that and my mother, so my mother's a physician, a family practice doctor, that I somehow worked my way into this space that I'm now in of cardiac arrest prevention. But if we go all the way back to high school, my mother used to volunteer with a nonprofit in San Diego, which is where we're from, called the Eric Paredes Save a Life Foundation. And that foundation was started by two parents who had lost their son, Eric, to a cardiac arrest tragically, right? Completely unexpected. He was an incredible student athlete himself, as healthy as you could imagine. And unfortunately, he lost his life unexpectedly to cardiac arrest. It was that plus my personal connection to cardiac arrest in our family. It's something that has happened to multiple people. It's happened throughout multiple generations. And so the combination of those two, me also being a student athlete, Eric losing his life being a student athlete, all those things came together for me to say, this is a cause that I really deeply care about, even as early as high school. I think my personality is such that I can't see a problem and just sit there. I like to get involved or do something to make an impact in some way. So if we fast forward in high school, I worked with this nonprofit. I supported them. I would volunteer for them. And as I got to college, I went to UCLA to do my undergraduate degree. As I got there with two of my best friends, I founded a nonprofit of my own called Saving Hearts Foundation. And we did a lot of the same work, which was trying to do preventative heart screenings for kids before they played in sports. And we would also help deploy automated external defibrillators, or AEDs, to underserved community centers, school districts, whatever it may be, that needed an AED to help make sure that they were protected. And those screenings that we did would be EKGs and echocardiograms to test for any warning signs or conditions in youth that could lead to cardiac arrest before they played in sports. So if anyone listening watches sports at all or is into sports, and you heard what happened to LeBron James' son as an example at USC, we were trying to prevent that. And if we couldn't prevent it, we were trying to make sure an AED was there to save that kid's life, just like he was able to be saved. One thing led to another, Christine, and over time, as I was about to graduate from college, I met my two co-founders for Avive and was lucky enough to meet them at an industry conference. I was there presenting data on our nonprofit's work in LA, and my co-founders Rory and Mosley were there, presenting the first version of a product that they had built at MIT as part of a senior year capstone design course. And it got a ton of notoriety at MIT that year. They're some of the smartest guys you'll ever meet. They built this portable defibrillator, the first prototype of it, in 12 weeks. And they brought it out to this cardiac arrest focused conference as well. And we happened to serendipitously meet, you can say coincidence, whatever it may be, meet at this conference. We were the only 20-year-olds there. It's a little bit of a joke, but it's very true. And one thing led to another, and I fell in love with the foundation of what they had built and how it could, I believe, impact the paradigm of response to cardiac arrest emergencies. And as we were all graduating from our respective colleges in 2017, we decided to found the company together and take a leap of faith together. So that's how we got to where we are today.
That's an exciting story. Did not know that's how you met your co-founder. That's sometimes timing in life is pretty interesting.
Right place, right time, all of that.
Yeah. Tell me a little bit before we go to the work that you're doing at Avive. Like, what are the things that you learned from your Saving Hearts Foundation that when you're saying doing all the preventive work, what are the things that when you went in there was not possible that you changed to make it now different? What the difference have you made?
Yeah, it's a great question. I think one thing that I'll mention, we had two sides to the nonprofit. The primary was focusing on preventative screening, and then the secondary was, can we get more access to AEDs? The second one, the access to AEDs, informed why I believed in what Rory and Mosley had built so much, and so I'll talk about that in a moment. But on the screening side, it is not a part of a child's annual physical exam today to get a preventative heart screening. So to get an EKG done, to get an echo done. And oftentimes what we found through the screening work that we did at our nonprofits, and nonprofits across the country and almost all 50 states are doing similar work, is that 1 in 300 kids have an underlying heart condition that could be fatal that they don't know about, right? Because of this lack of screening. And our data really showed that as well. You would have kids who were playing sports, doing everything normally, but they would have a fatal arrhythmia that they just didn't know about because their annual screening process, when you go to your physical, doesn't detect for that. And so I think bringing that to light and honestly, probably fortunately saving a few kids because of the screening work we did was incredibly rewarding. When it came to the AED side, I think I learned that there's a lot of challenges when it comes to actually effectively deploying AED programs today. And it was no different for us as a nonprofit trying to help a school or a community center or whatever it may be develop a program. You learn that there's a lot of gaps that make it really challenging. And that's really what we informed maybe my viewpoint of why Rory and Mosley's innovation at MIT could be really game-changing, is because I think it started to break down some of those barriers to developing and deploying effective AED programs that we feel exist.
There's two things that I want to know, like, what are the things that you see is a gap on the deploying the AED and the technology? Yeah. I want to talk a little bit on the screening side. As you know, my husband passed away from a heart attack, was, healthy on the outside, I guess, because he was athletic and fit, and died of heart attack while he was mountain biking. So I don't thing, you're right, it's not a standard procedure for kids to be screened enough because of the history. Now I send my son to get cardiologies
Yeah.
when he was at a young age. And even then I have to tell the doctor, I'd like to see the cardiologist. Can you get him an EKG?
Yeah.
Has that changed? I mean, like from what my experience, I still have to tell the doctor that we want this XYZ.
The good news, Christine, is there is a movement forming for it to change. I wouldn't say it has changed nationwide, and there's a lot of work to be done. But there are school districts, many, and counties across the state of Florida, and honestly, even a few in the South Bay, here in the Bay Area now, that now are mandating it for students to get an EKG and go through this screening process prior to playing in sports. And that is a massive shift in the progress that screening programs and convincing the medical community, school districts, et cetera, that it is important to do that. This is not a rare thing that happens. And so I think the good news is there's a ton of progress being made where 5 years ago, we could never have imagined it being mandated in certain places. And I think that's just going to spread like wildfire across the country as people see the data and impact that these screening programs are making.
Mm-hmm. So going to the second challenge that you're working on from your foundation that kind of also helped you form this Avive solution, the gap on AED. What did you learn and how does Avive close that gap?
Yeah, I think it is easiest to describe this like looking at the problem holistically, right? So if I can start at the beginning, cardiac arrest is a massive problem in the United States. It leads to about 350,000 deaths every single year, right? It's the leading cause of death of people over the age of 40. But what's shocking is of that 350,000, about 20,000 of those are youth as well. So it's the leading cause of death of school-age children as well. It doesn't discriminate, right? It can happen to anybody at any time. You described your husband, right? There's a prime example of where it's unfortunately what we call a silent killer. It is a sudden death that cannot be predicted easily, right? The challenge that we have with cardiac arrest, Christine, is that every minute that you don't receive a shock from an AED, your survival chances decrease by about 7 to 10%. So the combination of CPR, chest compressions to help pump blood throughout the body, plus an AED are what's needed to save a life. But our enemy is time, because every minute we don't get that shock there, survival chances are decreasing. And when EMS response times in the United States are 8 to 12 minutes on average, and honestly, that's the best case scenario. They do their best to get everywhere as fast as they can, but they can't be everywhere at once. And if you're relying on them to be the first ones to intervene, survival rates are resultingly in the approximately 10% range nationwide. That is the average survival rate for cardiac arrest. Now, Christine, the important thing is if you can get an AED to a patient and used before EMS gets there, survival rates shoot up to 40 to 50% in those cases, right? So access and time is the most important piece of the puzzle to being able to improve outcomes from where they are today. And I think the core piece of the challenge today, Christine, is that we have over 4.3 million AEDs deployed across the United States. And of all the cardiac arrests that have occurred or that occur on an annual basis, only 2 to 3% of the time are one of those AEDs actually brought to a patient and used on scene. That's an astoundingly low number for how many AEDs are there. And then when they do get there, we talked about how survival rates shoot up. So how do we solve that problem of, yes, there are AEDs out there, but are they accessible? Do people know where they are and when they need to be used in the most time critical moments of a cardiac arrest? Are they functional? Maintenance is a huge challenge. You can have AEDs out there, but if they're actually not maintained and properly working, it doesn't help anybody. So I think these are all the things that we realized is that we wanted to make sure the devices that we built at Avive and brought to market were portable, could be taken anywhere on the go. They could be used by anybody with confidence and not intimidation. But most importantly, we wanted to make them connected so we knew where they were, so that we could get them to patients more quickly and we can use the data or get the right data to the right people to eliminate these gaps that exist where you have AEDs out there and they're not being used on patients in the most time critical moments for that patient.
So when you're saying about accessibility, sometimes I see it, when you go to department store or the mall, actually, and then you say, oh, there's an AED, but most of the time, I don't see it. And is that what you're trying to solve, like to make it more like everywhere, or is it more for people to carry their own?
I think getting more AEDs out there is certainly a part of it and never a bad thing, right? But I think a piece of it, Christine, is also when you do deploy an AED, can we actually make sure that it's used, right, when it's needed? So if you don't mind, I'll kind of explain how we think about this. We've actually integrated our devices into the broad public safety ecosystem. So we partner with a company that allows us to have access or integration with about 90+% of 911 call centers in the country. So, Christine, what does that allow for? It's when that AED is on the wall in that department store that you're describing, or in a parks and rec facility or at a field, if there's a cardiac arrest nearby that, someone calls into 911, they can actually press a button that can activate our AEDs that are within a nearby to that location of that arrest. So let's say the AED at the park is within half a mile or a mile of that cardiac arrest. It'll actually alert. It'll start talking to you and saying cardiac arrest nearby, take this AED, and it'll provide you with a Google map showing you where you are and the location of the cardiac arrest is. And that data will be shared back with 911 that there's an AED or nearby. If it's en route to the patient, they'll see the AED moving. Once it gets to the patient and it's being used, they'll be able to actually see the real-time data from the AED in the 911 center and can be shared with EMS. And so what we're trying to do, Christine, is yes, get way more AEDs out there. And the vision is you carry one in your purse, in your car, et cetera. But also the ones that we deploy in these public settings, make them connected into the system of response so that they don't sit on the wall when there's a cardiac arrest a half mile away. We can actually activate them and get them to patients in those most time critical early moments of a cardiac arrest when that patient really needs that AED.
I think I remember when we first met, I think what struck me is that I think the portability of it and help us understand about your progress, how you evolve as a company, as a CEO. Oftentimes when a company started with the idea and then, with time, actually you learned along the way, you kind of adapt and change a little bit. Do you go through that process? If so, what that's like?
It's a loaded question. Yeah, of course. There's so much growth and evolution and learning that happens from day one to where we are, and it's still happening, right? When it stops, that's a problem, right?
Yeah.
And so maybe I'll take you back to me and my co-founders were 21 when we started this company. And so we knew what we knew was that we didn't know a lot. In fact, we didn't know most things. None of us had the background where we had brought to market a medical device before, had worked with the FDA before, had gone through a formal development cycle. Like none of these things were experiences that we had, right? And so I actually viewed that as the greatest advantage that we had compared to others, because for those that are in the med device space, our device is classified as a Class 3 PMA, and a Class 3 PMA is the highest bar when it comes to regulatory classification, and so the most challenging to get an FDA approval. And most people that we talked to early on that were experienced in the medical device space honestly discouraged us from doing this because they're saying, well, you're 21, go get a job. You guys just graduated from UCLA, MIT, why are you trying this pathway? You don't know what you don't know. It's right. We didn't know what we didn't know, but it was our greatest asset to not be jaded by prior experiences. And so I think the most important thing we did, Christine, that helped us grow and evolve was we got people on board and who believed in us, who had been through that process. And we could be for lack of a better word, visionaries who just pushed and pushed and pushed and pushed, and they could help guide us and give us the guardrails on the pushing, right? And
Mm-hmm.
that's folks like Dr. Fred St. Gore, who I know you know as well, has been unbelievably instrumental. It's our executive chairman, Mike Perry, who's been with us since the start, a 30-year med tech veteran. It's folks like even my father, who has a 30-year med tech veteran as well, who was incredibly supportive. And the best thing we did, I think, was listen and just follow their guidance, but never turn down the brightness of our ambition and passion to really change the space. And so the learning that I have maybe throughout the process is I don't really care what your back, and this is how I even look at adding people to our team. I don't care what school you went to. I don't care what your degree was. I don't care about any of those things. I think what I look for is hunger, passion, motivation, all of the intangibles, because I think we are proof that you don't have to have all the experience, but if you have those intangibles, you can accomplish a heck of a lot. And so that's a learning and thing that we all really believe in, myself, Rory, and Mosley at the company.
Mm-hmm. And so looking back, I think I heard a lot. I think Jensen Huang from NVIDIA was saying the same thing. Well, he was saying that if I know how hard it is, I would not have done it. And so I think there's that, bliss in that, not knowing sometimes. Look what you've done. What are the things that you wish that you knew back then when you started, or it's just like, I'm so glad I did not know, because otherwise I would not be where we are today?
What are the things I wish I knew? Honestly, I think that the answer is what you just gave. I'm glad I knew nothing. And it's because of what I just described, where a lot of things that we did, even in terms of the product and how we approached it, and the industry and how we approached it, how we're selling the product is different than how the industry sells the product historically. I don't think we would have been bold enough and ambitious enough to hold on to those core beliefs if we had been jaded by prior experiences and challenges that inevitably the industry of healthcare throws at you, because innovation is hard in this space. It is just hard, right?
Mm-hmm.
Maybe some of the things that I wish I if I had to pick one thing in particular is, when it comes to company building, and we knew this and we believe in it, but it's so true that it's all about people. And there is nothing more important than people, whether it's your team and the making sure you bring on the people that fit your culture and the vision you have, and inspiring confidence in that group, motivating that group, being a partner to that group, whether it's your investors, having the right investors and advisors and partners is essential. And it's not that we deviated from that or made a mistake in that. Of course, you make mistakes along the way, but I think I wish I had just known that or understood that. Everyone says it, but you understand what it really means when you go through it, that your teammates, your partners, your advisors, your investors, who you choose to surround yourself with on this crazy journey that you embark on, is everything and more, and really defines and dictates the outcomes in many ways, is building the right team and surrounding yourself with the right people. And I think we've been very
Yeah.
fortunate to do that well, generally, at Avive.
Yeah. And I think, I'm sure you hear that all the time. It's all about the people. And I think at the same time, that word is so simple yet so powerful, and also can be very subjective. Different people take it differently. So
Yeah.
in a way, it's personal. And so when you think about it, when you say, what does that mean? When you say the people, what does that mean to you?
Yeah, what it means to me is you can surround yourself with people that are just like you, and but I don't think that's an asset necessarily, right? Um, when you surround yourself with people to make your team better, your company better, I think that if you can find people that have some basic standards, right? High integrity is critical to us. High character is critical to us. Uh, Passionate, ambitious. These core things, those need to be truths in everybody, right? But then if you can surround yourself with people that think differently from you and aren't just going to say yes or do whatever you as a leader say is what you believe needs to be done, that's where the magic happens. Is when you have the people with those core values, plus they are people that are going to push you to think differently about the company, about the vision, about tactically what you should be doing, about your strategy. And I think that's what I mean by surrounding yourself with the right people is they need to have a set core, core standards or core values that you believe in. And then they ideally are folks who aren't afraid to tell you you're wrong, because you need a
Mm-hmm.
lot of that as you're going through the early stages of company building, and frankly forever as you're building a company, is you need people to give different viewpoints and perspectives, because the combination of your perspective and theirs is often where the magic lies, right? And you want to
Mm-hmm.
foster that environment.
And help me understand you started pretty early, starting that not-for-profit, and I'm sure it teach you something
Yeah.
that you carry through. What are the things that you learned from running that not-for-profit to this running a for-profit organization?
I think a lot of the skills and things you learn translate really well from running a nonprofit or a for-profit company. You're still leading a team and you're still trying to achieve a mission and objective. And I think what I learned, I mean, I think 18 when I co-founded the nonprofit at the time. And I think what I really learned was the importance of, as a leader and as a company, having a defined mission that you're all striving to achieve. Because what we do in healthcare, when you're trying to innovate, change the status quo, change a standard, is inherently incredibly difficult, right? There are only headwinds oftentimes pushing in your direction to change that status quo. And I think having a very clear objective, very clear mission that is bigger than any one person, right? In the case of both the nonprofit and Avive, it is literally about saving lives, right? Our device at Avive, it's very binary. Before it's used, the person is clinically dead, and after it's used, hopefully they are alive, right? And at Saving Hearts Foundation, it was about preventing it from ever getting there. We don't ever want a kid to collapse on a sports field or a basketball court. Those are two very tangible, inspiring, um, very like you can it's direct, you can see it happen, right, when you do the work. And I think having that was something that I learned was really important. When I started the nonprofit, it was just, let's do a screening, let's do a screening, let's do a screening. Well, why are we putting in our entire weekends and nights in college doing this? And it's because we gotta articulate the mission and vision, like what's the impact we're trying to create in a community. And I think when I learned that that is critical, um, it really changes the environment that you create in your workplace and with your team when you're all striving to something way bigger than yourself. And I think that's really, really important to do, and something that I learned very early on from Saving Hearts to Avive.
Yeah, I think that's very. It's. I like the story. I like the connection, that how you move because you really care about your community, and I feel like I hear that from you, and also I think it also inspired the work that you do at Avive, even though it's a for-profit. I think that's really wonderful. I know we are short on time. Couple things that I always like to ask is like, what are the lessons learned that you impart to your 21 years old self?
The lessons learned are, this I could probably write a book on the things that you learn along the way. But I think I've said a couple of them, right? People are everything, and prioritize them and surrounding yourselves with the people that you deeply care about all the time. Like that should be a core North Star for yourself when you're building any organization or company, for profit or nonprofit. I think another lesson learned is have conviction, right? And don't lose the conviction just because the path deviates a little bit from where you thought it was going to go. The journey of building a company is inherently not linear. It's never linear, right? It is, in fact, as many people always say, a very much a roller coaster, right? And when you're on the dips of one of those roller coasters or the valleys of one of those hills, whatever you want to say, it doesn't mean that everything you've thought about so long and hard and worked so long and hard for was wrong, or you had the wrong approach or the wrong strategy. It's just inherently hard. And so have conviction in the work you've done to develop the thesis and belief and product or whatever it may be that you've developed, and keep going. That doesn't mean keep going for years, right? If it's not working, but it means have conviction, and so that you can fight through those valleys and dips in the roller coaster, and try to stay as even keeled as you possibly can. And that's something that I've tried to do as best as I can at both Saving Hearts and now also at Avive. And then number 3 is the other lesson learned is, honestly, like, just self-belief, even during those periods of doubt and uncertainty. When maybe I'm mostly speaking to folks that are younger when they're founding a company when I say this. You will always be thrown with people who have more experience than you, and rightfully so. They have more experience. They've been through it. All the reasons why something may not work, all the reasons why maybe you shouldn't approach something in this aggressive of a manner, or you should go the safer route or an approach. Honestly, innovation doesn't happen when you follow the path of safety and least resistance. Oftentimes, you don't change the status quo. You don't change paradigms in aspects of healthcare by listening to everyone that's done it a certain way, because that's why it's being done a certain way, because it is the status quo. And if you really, really believe that what you're doing can change things for the better, believe in yourself and believe in that conviction, and just go do it and give it a shot. You can always pivot and iterate. But I would just really encourage people, especially when you're younger and maybe don't have the experience to push back on folks, believe in yourself, because I think sometimes a new, fresh perspective is needed, and you can be that new, fresh perspective.
Mm-hmm. That's a great answer. Do you have a moment or like some sort of a mantra, or what do you tell yourself to believe in yourself, or to let you go through when you're in the valley part? Is like, how to you remember that this too shall pass? Is there something that you tell yourself? Because, it might be helpful to hear.
I think what I always remember, maybe I don't tell myself, but I remember back to, is all of the valleys that we have been through. When you think about them, were just that. They were a valley, right? But what we did to get out of the valley, we just kept doing the work. We kept our head up, put our nose to the ground, and just kept doing the work and having that conviction that we always had, right? And so in terms of like a mantra that I tell myself, it's less that, and it's more a mindset of this is just a part of the process, right? And tomorrow, what's crazy about a startup is the same day you can think you're on top of the world, and then by the end of the day you could think, oh, I don't know if we're going to be around tomorrow. Like that is the reality of running a company and a startup. But you can never let yourself feel either of those feelings. You just have to stay right in the middle. And that's the biggest challenge. And I think that the most important thing that I tell myself is nothing is that awesome and nothing is that bad. it's generally right in the middle somewhere, and you just got to keep doing the work. Wake up the next day and just keep doing the work. And because you'll get humbled and excited in the same day. And so that's how I think about it, Christina. I wish I had like a mantra. Maybe I should come up with one that's this perfect thing to tell myself. But I just tell myself nothing's as good as it seems and nothing is as bad as it seems.
Yeah.
That's how I keep going.
Which is true. Which is true in everything in life, in a way, actually.
Yep.
It's always kind of that way. I know I said last question, but I have one more question. Do you have any stories that, real life story that impact people's life, and how's that make?
Yeah, that's the beautiful piece of the industry we work in, is that the impact we have is saving lives, quite literally, right? And so every day when we walk into our office, we have a live save counter on the wall. And in our all hands meetings every month, we update it with the lives that were saved in the prior month. And it's an incredibly inspiring thing to look at, motivating, I should say, thing to look at as you walk into the office. There's a number of them. I'll maybe try to tell a couple. We had in California, in Northern California, at a high school, there was an athletic trainer who saved the life of a parent at school with our device. But I think how it happened is even cooler. This athletic trainer at a high school had met our team at a conference and a trade show and said, "I really want these devices," and she advocated with her school and district to get them. She ended up getting our device delivered to her, a few of them, and decided right before the sports started after school, to take one out with her on her golf cart, which is what she wanted to do. She wanted to be able to have a portable device that she could take with her anywhere. And so she's at the baseball game, and one of the parents, a dad in the stands, collapses while watching his son play baseball. And thankfully, she's able to use that device and ultimately save the dad's life, in the stands. But what's crazy about it, Christine, is that she actually received the AEDs in the mail 2 hours before she was actually going to go out there for the sporting events after school. And so it's not even just that we saved a life, but just how time worked out there perfectly in her favor. She could have said, "Oh, I'll take them out tomorrow," right? But she decided to take them out that afternoon. And thankfully that child now still has his dad, and he's able to now come back to his baseball games. And maybe one more I'll share. This happened right before Thanksgiving. We deployed almost 170 of our devices in Northern Kentucky. So now 3 or 4 counties in Northern Kentucky have one of our AEDs in every police vehicle. And the day after the deployment, one of the police departments used our AED on a gentleman who was, I think, in his late 30s. 2 days later, we get a picture of him with his family at Thanksgiving. And that there's nothing better than he has 4 kids. He has a wife. And what's even crazier, Christine, is the police officer who used the AED on him was also a survivor of cardiac arrest. And so I could tell you for 3 hours stories like this where our device has made an impact. But I always talk to our team about, when we save a life, we aren't just saving that person. We're saving those kids. We're saving that wife. We're saving his parents. We're saving his siblings, his uncles and aunts, his whole community. And that's a massive responsibility, and what an honor and gift that we've been given to have that responsibility. Because of the work that we're doing, thankfully, all of them have been saved from a lifetime of heartache. And that makes us really proud and happy to do this work that we do.
No, thank you. Thank you for your work, and appreciate your time and sharing your story. And I always love the work that you do.
Well, thank you, Christine. It was a pleasure to be on, and thanks for giving me the opportunity to share.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful, and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minotto, and thank you for listening.